prayer, or it might not be that short. We'll see. By Pastor Bill McGill of the Monty Baptist Temple, and then we will get started.
Short? I'm a Baptist preacher, really? Join me in centering yourself in God as you know God to be. Oh God, we come at this morning's dawn to celebrate 25 years of the health vision being drawn. Thank you that a quarter century ago, the poor handmaids decided to deal health inequities a much needed love. They had a vision and developed it into a mission. They had a vision that only needed God's permission. They felt a supernatural calling, and that spirit has sustained them for all these years without falling. Thank you for their present leadership team who work in an earnest and deliberate manner to fulfill the founder's dream. Keep inspiring them with community initiatives that provide the least and the left out with a preventive route. Let their motives remain sincere and pure until for every disease there is an accessible and affordable cure. Thank you for this brave and courageous speaker who refused to snap, but instead used her notable skills to expose the racial pain gap. Far too many women are treated at an inferior pace simply because of the color of their face. Far too many women are not treated with respect and grace simply because of the color of their face. Had our speaker not decided to become a healthcare critic, who knows how many other women would have ended up as nothing more than a statistic. So bless the time that we share together, but let it be more than a networking pleasure. Let it inspire us to lead, and where necessary, begin to apply some social and institutional pressure. Let us leave here fired up to ensure that all have the same opportunity to drink from the healing cup. Let us leave here free of any indifference and apathy, with a dogged sense of moral audacity, to expand our businesses or organizations' compassion capacity. Some of us woke up far too early to not leave here with a level of concern that is firm and sturdy. So let us begin this day in a sacred and solemn way, and then solidify a level of commitment so that it never begins to stray. This we ask in the name of God as we know God to be, and all the people said,
Amen. My name is Sharon Tubbs. For those who do not know me, I am the Director of Health Visions Midwest of Fort Wayne, and you are in for, I don't want to say a treat, but I want to say a treat, but also a morning of enlightenment, a morning of growth, a morning where you may experience as many laughs as you do pricks in the heart. Because we want you to leave today having thought about something that you never thought about before. I don't know what that is, okay? I don't know what it is for you, but we are interested, not in just bringing people together for a fundraiser, but every opportunity that we get, we want to instill something in you. We want this to be a moment, not only of sacrifice of your time, but of receiving. I am going to start this off with a little bit of history. I'm going to be your historian this morning, because this is our 25th anniversary celebration. Can we get a little hand? Who would have thought, who knew that we have been here for 25 years? Can anybody believe that? Who can't believe it? There's this whole rich story of how we came from the poor handmaids. We were founded by the poor handmaids of Jesus Christ, a Catholic congregation of women who came over from Germany, no less. In 1868, they were called to Fort Wayne to serve. And the more I looked into them and the Catholic church, I saw so many interesting things about how the Catholic Church was very involved in what was called the Black Hospital Movement. And they would help to establish hospitals throughout the nation where African Americans could practice medicine because they couldn't in the regular hospitals. They they would establish these churches where patients who were suffering, patients of color, could come and be healed because they wouldn't get the same service in those other hospitals. And so the poor handmaids came over from Germany. They came to Fort Wayne to do good. In 2000, we did something that was groundbreaking. We began to really dig into this issue of community health workers. How many people know what community health workers are? Okay, I'll get you to raise your hand, get a little into it. That initiative was spearheaded by Health Visions Midwest, bringing the knowledge and the training about CHWs to Allen County was started by Health Vision. During that time, we were doing all kinds of things. There were wellness clinics. We call those health fairs today. We were making medicine, we were making healthcare accessible to people in areas that didn't have that access. That is the organization that I am so proud to be a part of right now. We began to train farmers, people in Southeast Fort Wayne to be master farmers. We did a groundbreaking research project, groundbreaking for its time because we got money to find out more about the effects of diabetes on African Americans and Latinx communities. Nobody was doing that back then. But we found it to be important enough to do that type of research. That's Health Visions then and now. 2020, y'all know what happened. It was COVID, everything changed, and that's when I actually came on board. Everything went virtual. We began to really home in on immediate needs. One of those needs, of course, was COVID. And so at that time, we, Health Visions, worked with the state of Indiana to bring the first COVID-19 testing site to Southeast Fort Wayne. It was hard to get a test back then. Okay, you remember me and Jen? You were there. We established in 2021 the first and only vaccine messaging task force. We rallied more than 40 organizations, participated in this task force to break down barriers for people to get registered for COVID-19 vaccination and to learn more about COVID-19 vaccination. We did that. We launched a health equity series for community leaders to know more about health equity. What is health equity? An issue that is coming to the forefront more, but that many people still don't know about. We hired this year 2 new team members that I'm proud to say that you're going to meet all of our team today. You're going to meet all of our team today because what we do is so important, partially because we're the ones doing it. And we are in the community. When people work with Health Visions, they're not just working with an organization that wants to do good, although those organizations that want to do good are good. They're working with people who are from the areas that we serve. I'm from the 46803 zip code, born and raised. I haven't lived here all my life. I went away for 20 years. Wanted to live in the big time. Came back begrudgingly. But it was a calling. I grew up as an at-risk student. That means I was young, black, and on the wrong side, some would say, of the railroad tracks. So we're going to have 2 of our Health Visions workers come up, our team, and acknowledge our sponsors.
Hi everybody, welcome and thank you so much for being here. We really appreciate it. My name is Lupita Valdez and I'm the bilingual community health worker from Health Visions Midwest. I live in the zip code 46807 and the people I serve are my neighbors and I'm happy for it. What I love the most of my job is just have the opportunity to help people. You saw already a lot of my work on the video, and now here's my coworker.
Yes, thank you for all the work that you do. She doesn't miss a minute. Well, good morning, everyone. How we doing? Good. So my name is Cassius O.A. Stallings. I currently live in the 46806 zip code. However, I grew up in the 46816 zip code. My role with Health Visions Midwest of Fort Wayne, I serve as the wellness coordinator, where I get to oversee programs like Aspire, a once-a-month webinar where we discuss topics like maternal mortality, suicide, and youth health, or our program called Healthy Safe Sanctuaries, where we get the opportunity to partner with churches in the city of churches to create a culture of health. All of these programs wouldn't be possible without you all answering the door, so thank you. Right now, we want to take a moment to acknowledge the folks that helped put this event together, our sponsors. In the platinum category, Ruoff Mortgage, thank you. In the gold category, St. Joseph Community Health Foundation. For the silver category, Dr. DeAndre Dowse. Neighborhood Health. And Aging and In-Home.
Okay, where we go with the sponsors of bronze. Bronze sponsors are Imani Temple, Brotherhood Mutual, IU Health, Axia Solutions, Positive Resource Connection, and Premier Bank. So thank you so much.
This is my second part of kind of our history. When we were thinking about doing this 25th anniversary, there was absolutely no way whatsoever we could do it without acknowledging a woman who was very special and foundational for this vision. This is my predecessor, Renetta Williams. When I came on to Health Visions, Renetta had been here for 20 years. I came on in 2020. She had been there almost from the beginning. And she started in April 2000. But when I came, Renetta would be in the room, and Renetta's, she's big time. She used to work for Governor Evan Bayh and travel all over and do all of this. And, she took a pay cut to work for Health Visions because her heart was so pure and lovely. So, she was all that. And I would be a little skittish to be in the room with her and talking on behalf of Health Visions. And I would always say that, I'm filling some big shoes. I have some big shoes to fill, and I don't know that I can fill these big shoes. And after I had said it for I don't know how many times, Renetta took me to the side and she said, Sharon, don't fill my shoes. Bring your own. That was so freeing for me. And that is the kind of person and the kind of heart that Renetta Williams has. There's a saying in the black church, and a lot of black churches. And the saying says, give me my flowers while I yet live. Oh, Renetta, we do have your flowers today, literally and figuratively.
The plaque says, Health Visions Midwest, presented by Health Visions Midwest in honor of Renetta Williams. You served the Fort Wayne community with compassion, wisdom, and honor for 20 years. Your commitment and advocacy on behalf of underserved residents set a firm foundation for the work that we do now and the services yet to come. September 2023.
All I can say is, wow, what a surprise. But you know, I have loved serving this community. I first say to the poor handmaids of Jesus Christ, thank you. Thank you for selecting me to carry out your ministry to the poor and underserved population of this community. It has been a pleasure. When I first came on, it was a commitment in which I was afraid to step in. I said, Lord, I've never done this before. I need your help. He opened up my eyes that I may be able to see the needs of this community, along with the vision of Don Barnes. Don was a wonderful visionary. He could come up with the program, and then he would say to me, Renetta, you need to implement. And I would say, what? He said, you can do it. And so we came up. When I came on board, I was actually, had been working with Governor Bai, and I had 15 counties in Northeast Indiana, so I knew how to build a coalition. I knew how to bring people together, but I didn't know how to actually put the service in the community. And he said, you can do it. You figure it out. Whenever you go from one job to another, your skills transfer. So he said, transfer those skills, and you can do it. So I did it. And we actually did an awesome job with my team. And you saw this. So all I can say is thank you to my husband. For 20 years, they would, when we were in the community, they would say, oh, you know what? Oh, you're Renetta's husband. So he became Renetta's husband, but he still stayed with me. Thank you, honey, for staying with me. Sister Loretta and I, we always had the jokes. They would always say, which one do you want? You want the sister or the sister? So we laughed about that quite a bit, and we love working together. I love you. You know, this is so wonderful. When I retired, you know, the pandemic came. So I never got a chance to say thank you. I never got a chance to say, I love you for accepting me as I am. So thank you, thank you, thank you.
Yeah, because I feel like I'm an associate of Health Visions. She said 20 years in the time that she has been with Health Visions, but this is our 49th year of our wedding. We are planning now, for our 50th is that Jubilee, so we're excited about, the Lord say the same, our 50th for next year. But it's just been a joy and a pleasure and a wonderful opportunity to serve. Jesus said, if you want to be great, serve.
All right.
And so here we all are, selfless servants, rendering unselfish service. And so we're grateful to God. I want to say on behalf of our sons are not here, but they are watching on the video. They couldn't be here, but they wanted to express to their mom how glad they are that she is their mom, and from us, from the Cedric and Torrance, and from me. And three wonderful grandchildren, London, Taj, and Trace, who we take delight in spoiling. God bless you all. Thank you so much.
Just say, and I'm the office manager and HEAL coordinator here at Health Visions Midwest. As the HEAL coordinator, it really brings me so much joy and passion to be able to serve in an area that I experienced growing up, which was living in a food desert and food insecurity. So it really just makes me excited to get to run this program. At this time, I want to call Dr. Marcia King, who will join me. Health Visions Midwest recognizes the important role of people who humbly serve and sacrifice to help others live healthy lives. In that spirit, we award this honor annually, using guidelines based on our core value, which is found in your booklets, to achieve. Oh, and one of these core values includes dignity and respect for all. And a few other characteristics I just want to name is that Dignity Award recipients are those who listen attentively and respond courageously to the needs of the time. Also, they willingly sacrifice and serve wherever the need arises. Now, if you learned anything from the previous speakers, you would have gathered that since the beginning, Health Visions has been focused on listening to the community to learn the needs and the desires of the community. In that same light, we opened this year's Dignity Award nominations to the community to see who you were seeing serving, who you were seeing showing dignity and respect for all. We have decided that we will recognize all of those who were nominated. So the first one that we will recognize is Cha Soo-man. Cha tirelessly advocates for underserved Burmese refugees and immigrants. She humbly serves by educating clients about the services provided through neighborhood health and by connecting clients to community resources. Thank you, Cha. And if Cha will come on up, so we can recognize you, come on up. And on this plaque it says, Dignity Award 2023 Certificate of Nomination, proudly presented to Cha Soo-man for exemplifying dignity and respect to all by humbly serving and sacrificing to help others live healthier lives. The next nominee that we want to recognize is Joshua Rogers. Joshua started LIVE, which is LIVE semicolon T's for Teens, to create a change and be an advocate for our youth. When Joshua talks to youth, he shows them that he cares, that they are seen and heard, and he offers hope to live beyond their current circumstances. Congratulations, Joshua. We are also recognizing Nancy Cripe and Pat Turner. Nancy and Pat have so much dedication and passion for addressing tobacco use in our community. They work tirelessly and always with a positive attitude to keep the work moving forward. Congratulations, Nancy and Pat.
It is my pleasure to introduce to you those who won the awards after a very, very hard selection process. As you can see, these people are all fabulous. We would like to present an award to Tyann Achenbach. And is one of those people who has been fighting with the state. This is why we had to give this to her. There's a program called the HEAL program that receives benefits from the state of Indiana. The state has changed up that program. I'll tell you about it sometime. But it's almost harder to get some watermelon, free watermelon and some peaches than it is to register to get a gun. It is so tough now because of the guards that they put up to prevent fraud. And because of some changes in the finance system that they had to make. So now you have to have a QR code, an email, a smartphone, and all of that to receive these state benefits. And most counties in Indiana elected not to receive the benefits because of the difficulty in signing up for this, the training that would be involved. Every time we talked about it, got on a call, Tyann would be saying, look, I'm going to be out there, I'm going to do what it takes. She would be out there till 8 o'clock at night. And out there, I mean, at McCormick Park, which is one of our HEAL sites, at Parkview Greenhouse, working by herself. She was the only one that was able to do this from the WIC office. Award recipients, I would like to come up, Hey Mar and Tong Thaken. They're both faithful workers with Catholic Charities. And we could not resist. These are the type of people who work on their own, who stay past the deadline. They don't know what the end of the workday looks like, because the end of the workday for them is when the people that need the help have been assisted, have been helped. They're a little shy. They don't like this recognition. And so we had to, they were the individuals who were recognized. We said, you know what, we know it's a team effort. We know that everybody had to pitch in. So we're just gonna go on ahead and give it to Catholic Charities Refugee Resettlement Services. And right now, I'm going to ask another one of our team members to come up, and then she's going to introduce our speaker, who many of you have been waiting for. And again, this is all flowing with, I'm just talking till you get up there. Dignity and respect.
Good morning, everyone.
Good morning.
I am Nia Hinton, born and raised in the 46806 area code. I am a Healthy Child Advocate and Health Visions Midwest newest team member. I was very excited to take the role as a Healthy Child Advocate because I've always found myself advocating for children, whether it was for my own or the various children that I've crossed paths with, whether it's been at the schools or daycares that I worked at and volunteered for. But for me, advocating for children is more than just that. It's advocating for the moms as well. Because I personally feel like, a healthy child comes from a healthy mom. Being a woman and being pregnant, becoming a mother is supposed to be the happiest times of a woman's life. But unfortunately, not all of us have that story. In 2010, I became pregnant with my first child. And what was a pretty good pregnancy took a turn about my 38th week. I was swollen, retaining fluid. I had horrible headaches, and I had pains in my body that I couldn't even describe. So I would call my doctor every single day. I called a week straight, actually, every single day. And I would tell him the pains I was feeling. I would ask him what medications could I be taking, and he would tell me I could take anything. Anything over the counter, is what he would say. Or I would just, ask to come in, and he would tell me I was fine. I was fine. Kevin had not seen me or examined me at all within that week of me calling. He even went so far one time as to tell me that I was a overreactive first-time mother. So he got pretty tired of me calling. So one day he just agreed to allow me to come in. So I went into the doctor's appointment. I had an ultrasound. And after that ultrasound, the feelings that I had felt, they were confirmed. There was something very wrong. After my ultrasound, I was asked to step into the private office of the doctor. And he walked into the room. He never lifted his head up. He didn't even give me eye contact. The words that came out of his mouth changed my life forever. He said, Nia, your baby is dead. Prepare to go over to the hospital and give birth. I was in labor for 36 hours to give birth to a child that I knew would come out dead. All because my pain wasn't taken serious. All because as a Black woman, I am expected, looked at, and assumed to be able to handle more pain than others. As Black women, oftentimes, especially when it comes to doctors and with healthcare, we are looked at and assumed as overreacting. And that word sticks out to me the most when he said that to me, because my concern for my body, me trying to advocate for my body, was looked at as overreacting. My pain just wasn't enough. I had to be near death to be taken serious, and even then, it is questionable. We've been speaking a lot today about dignity, and to me, dignity is being able to extend to others and believing in their experience, which is why I am so pleased today to introduce our morning keynote speaker, author of the book, The Pain Gap, How Sexism and Racism in Healthcare Kill Women, a book that explores real women's tales of healthcare trauma and medical misogyny. She took an in-depth examination of women's health crisis in America. Because like me, she thought that giving birth in the richest country on earth, she never imagined that she could almost die in childbirth, but she did. That experience put her on a journey to explore, understand, and share how women, especially women of color, are dismissed to death. So without further ado, I would like to introduce our keynote speaker of the morning, Ms. Anushe Hossain.
Hello everybody, my name is Anushe Hossain. Can everyone hear me okay? Yeah, I usually don't have a problem with people telling me to speak up. I am never at a loss for words. Nia, I wanted to say thank you so much for sharing your story. I am not gonna cry. I am not gonna cry, I have different plans. But I see you, I honor you, and thank you so much. Thank you so much for sharing your story. Stories like Nia's are so important because we so often get wrapped up in numbers and statistics, and we forget that every number is a woman, a person, a human being. We often hear she was somebody's wife, somebody's daughter, someone's mother, but I always like to say she was somebody. She was a person. Right. So I don't know how you move on from Nia's story. I'm completely put in another realm, but my name is Anushe Hossain, and I am the author of The Pain Gap, How Sexism and Racism in Healthcare Kill Women. I could not be more excited to be here today, and I thank Health Visions Midwest for inviting me. I feel like I'm a member of Health Visions Midwest as well, and Sharon, I feel like you're my long lost, I don't know, sister, mother, roommate, and I love how we're coordinating with Health Visions colors. Thank you so much for having me. I always like to really connect with the audience when we speak about such intimate and personal issues. But I felt like as soon as I walked in, I was already connected to the energy in this room. It's great, it's tangible. Health Visions Midwest works to advocate for underserved, develop and facilitate partnerships and address systemic community health disparities. Getting the opportunity to speak with this audience is an honor because you're the people who work every day to make healthcare in the world's richest democracy equitable and accessible for everyone, a core theme of my book. I have a really unique relationship with healthcare in America. I guess you could say I think about this a lot. I grew up in Dhaka, Bangladesh in the 1980s. Does anybody know where Bangladesh is? Who? I saw one hand. You do know, where is it? Extra points. Whoever can guess gets the balloons. I know the Burmese, the people must know. Anyhow, we're in the east of India. No, we're not India anymore. But yes, so that is where I was born and raised. And when I was a little girl, I grew up literally watching firsthand how American aid can come in and completely change a country's concept of health. I mean, America really introduced the idea of public health in Bangladesh. And when I was growing up, we had one of the highest maternal mortality rates in the world. And America played an instrumental role, not only in bringing that down, but in introducing the concept of public health to millions of Bangladeshis. They were instrumental in the 80s and 90s in taking Bangladesh from having one of the world's highest maternal mortality rates to turning us into a development star. Healthcare was framed not only as a right, but as a means to empower women and girls. Growing up in Bangladesh, I did not think it was possible for women to die in childbirth in America. I really didn't. But decades later, that is exactly what almost happened to me at one of the best hospitals in Washington, D.C. It was an eye-opening experience, to say the least. America helped my motherland, Bangladesh, slash its maternal mortality rates by 40%. But today, more women die from pregnancy-related complications in the United States than in any other rich country, and that number is rising. But I don't focus on maternal mortality because I almost died giving birth in America. I focus on it because maternal deaths tell us more than just the number of women dying in childbirth. The World Health Organization recognizes maternal mortality as an indicator for how well a country's healthcare system is functioning. It tells us about women's overall position in society. Because in the year 2023, no woman should be dying in childbirth, let alone in America. Shocker, much like with many systems in America, there is a massive racial factor driving this country's maternal mortality crisis. Black women are 3 to 4 times more likely than white women to die from pregnancy-related complications. And I really want us to pay attention to those numbers because we hear them a lot, and I feel like we've almost become kind of numb to. They sound big, it sounds bad, but put another way, that's 243% more likely to die giving birth in America than their white counterpart. And for decades, there were really racist explanations for this. You know, they would say that it's an education issue, or black women are welfare moms. But now we know, and especially after the pandemic, that it's racism and not race that is driving these disparities. In addition to really rich, powerful women, like successful women like Beyonce and Serena Williams, also sharing their near-death experiences. A major study came out that found, actually just earlier this summer, that found that not even wealth, not even money will protect the wealthiest black families when they go in to give birth in America. Then there was a study that came out last year that showed, because for a long time this education thing was thrown around a lot, that it's an education issue. That's why more black women die than any other group. But now there are studies that show that a college-educated black woman is still 5 times more likely to die from pregnancy-related complications than her white counterpart with a high school degree. So, the COVID pandemic highlighted the massive role that women play in healthcare around the world. Women make up an estimated 2/3 of the global healthcare workforce and constitute approximately 85% of nurses and midwives. Women also make up the majority of long-term care workers, just over 90%. But despite these critical roles that women play in taking care of the world's population, their own health remains an afterthought. In fact, a 2020 report by the Center of American Progress concluded that the U.S. healthcare system has never integrated or centered the healthcare needs of women. However, despite the doom and gloom, the pandemic has given us a huge opportunity to fix what's wrong with how we approach healthcare. My husband's always like, always talking about such depressing things. I'm like, but I'm actually very positive. I'm actually a very positive person. We're not trying to cure cancer or AIDS. We actually have all the tools and resources we need to turn this around. The pandemic has given us, yes, a huge opportunity to fix what's wrong with how we approach healthcare. I always say we are in a solvable crisis. We already have the tools, the resources, and knowledge to turn things around. To grab this opportunity, we must stop viewing women's health as an issue that only impacts women. and start looking at it as a human rights issue we should all be invested in. But why should you care about women's health? How does investing in women's health help everyone? Because women represent the cornerstone of a family's overall health, and they overwhelmingly manage the health of their household members. By the way, this happens whether you choose to or not. I mean, let me tell you something about middle age. These more and more responsibilities just get dropped in your lap. I'm now totally the healthcare manager for my aging parents. I never knew that was going to happen. When women are healthy, they make sure their children have access to quality care. Women's health is an indicator of the overall health of a community and country. These are actually messages I grew up hearing from the US State Department because they would have such massive education campaigns. And now I feel like I need to get some of those billboards and bring them back here. But how do we actually go about investing in women's health? I believe there's three things we have to do, three key things. First, we need to start thinking of women's health as a priority, not an afterthought. To do this, we must gain the support of men. Men, where are you? Always very quiet and feel very awkward. Think that, women's health is something you can't contribute to. But men actually have an incredibly important role to play in improving women's health and rights. They are not only our partners, but they are also at times our most important witnesses. There can be no major change in women's health without men as our allies. And I know I speak a lot about maternal mortality, but even my husband, even before I wrote the book, there were so many times where I doubted my own experience and I doubted my own story. And they always say that you're imagining it or it's all in your head or you're being hysterical. So even after writing this book, and I'm still kind of processing the trauma of my experience, sometimes I'll just say to my husband, maybe it wasn't that bad. Maybe I did just imagine it. And he'll be like, no, I was there. You were shaking, your fever. So it's so important, when men speak up, when they say, yes, I was there, or yes, she needs this, or just to stand there and be our allies is really important. Second, we need to increase research in women's health. This drives me absolutely crazy because I feel like we can do this any day and we're not. The lack of research that has actually been done on women's health is shocking. The Food and Drug Administration excluded females of childbearing potential from clinical trials from 1977 to 1993. This policy even extended to mice. There's even a mice patriarchy. Like, if you think how many fronts we are fighting this battle. The National Institutes of Health is the primary agency of the United States government responsible for biomedical and public health research. Didn't have until the 1990s a mandate to include women in its clinical trials. And things have not gotten better. The systemic exclusion of women from clinical trials continues even when the medical condition impacts more women than men. Heart disease is the #1 killer of women in America, but only a third of the participants in clinical trials are female. Less than 45% of animal studies on anxiety and depression use female lab animals, even though these conditions are twice as common in women. 66% of Alzheimer's patients are women, yet just 12% of research funds focus on that. The list goes on and on. Lastly, but perhaps the most critical step in turning around this country's healthcare crisis is that we must start listening to and believing women. In addition to, it sounds so simple, but it's so difficult for people to do. In addition to the pain gap and the knowledge gap in women's health that I discovered while I was writing my book, something else I also discovered was the credibility gap. Women are not believed about our bodies, period. We're not believed when we say we've been raped, harassed, or in pain. After speaking with so many women from my work in research, and by the way, every woman has a story. Every woman has a doctor's story. Or she knows somebody else that has. When I got my book deal, first of all, it's really scary, and you're just like, oh no, now what? I started my research by speaking with women. And every woman was like, oh, you have to talk to her, and then you have to talk to my sister. Every woman knew someone, and it was just crazy how for so long I thought what happened to me only happened to me. And that I did something wrong, or somehow it was my fault. Even though, you know, I'm in this field, I work in this work, I still kept thinking that. And when women start sharing their stories and start telling each other their stories, you realize not only that you're not alone, but how widespread a problem is. I mean, I compare it sometimes to police shootings, because we'll hear, well, maybe it was just one bad apple, or maybe, you know, that guy was bad, or this situation was, you know, he asked for it, or what have you. But I feel like if you step back and look at the numbers, a pattern emerges. And you have to ask, what is going on? Where are these numbers coming from? Why is it getting worse? And you know that the actual numbers are probably even higher, right? How many of these deaths go unreported? Oh, man, I can talk about this for the whole day. The hundreds of healthcare leaders and experts at Health Visions are out there in the trenches. You're on the front lines. You have the power and the knowledge to spark the healthcare revolution America needs. When I give these talks and I get to meet groups like Health Vision, it makes me feel so hopeful and positive, because I feel like we get such bad news and you hear about bad things that people are doing, and then you're just like, look at this. This is what makes America so great. You know, community leaders, community working together, really caring about your neighbors. I mean, sometimes I feel like it's a uniquely American attitude and outlook. And I love it. I love it. And you know, it's still out there, guys. So you guys give me a lot of hope. You know better than most how healthcare is simply not accessible in this country for too many Americans, and it does not have to be this way. It should not be this way. Thank you so much.
Thank you, Anisha. Wasn't that not wonderful? And I'm loving the coordination. We didn't It's time for Q&A. If you have a question for Anisha, please, there are pens and little notepads on your table. Please write those questions. Our Health Visions team will be on either side here. When you have your question written down, then they will bring the question up to me, and I will man the question. Woman, yes, I will woman the question. Thank you very much. They're thinking deeply. One of the things that I didn't mention before, too, this is time for me to give another plug. I just got some of the statistics yesterday for the first 6 months of data for Health Visions Midwest. And in the first 6 months, I love my paper down at the table. But with our health education program, we serve, that's okay, we served more than 700, we had more than 700 contacts with individuals, 90 health education classes, and in those classes and the people that we served, 95% of those improved in their attitudes toward health. Can we get a little hand for that? They thought differently about health, about their own bodies and health than they did before. Okay, y'all, I got enough questions for y'all. Y'all just start right quick, just like I said. Okay, here, so let's take a look at this. Okay, wonderful. Anisha, how can we better train our health workers on implicit bias and improve our outcomes?
That's a really important question. I feel like people need to implicit. I have such a problem with this word, implicit bias, which I feel like is like a very trendy. You know, I'm going to be a little politically incorrect, but really white way of saying, what is it, like racism? What is it, like everybody's own discrimination and prejudices? First of all, I think people should be honest that we all have them, and it's okay. If you feel like it's going to interfere with you doing your job, please, especially if you work in medicine, maybe step back. Maybe get another profession. But I think that we I think one of the best things that I think came out of the pandemic is that we're more, still uncomfortable, but it's really hard to talk about race in America. A lot of people don't like it. It's not usually people of color that don't like it. I think we have to live with it and deal with it. So I think a lot of people get uncomfortable. And when I was first writing my book, my editor was like, I think we're talking about race too much. I mean, you're bringing up race all the time. I'm like, well, can I put it in the title? Actually, of the book. It's a big issue. So I think that people get very sensitive about speaking about race in America. And I think that we can't talk about healthcare in America and the crisis that we're in if we're not honest about race. So I don't know how you can train people better when you aren't being honest from the get-go.
Thank you. And I'm going to give a little plug. We are working at Health Visions. We are working on a health equity course next year, where we will be talking with people about identifying these biases, this racism that is occurring so prevalent. So stay tuned for that. Okay, we won't be able to answer all these questions. Sorry. Postpartum depression is dismissed in most women. Snap out of it. But that's what it says on her. How much worse is it for women or of color?
An important question because the FDA actually just approved the first pill to treat postpartum depression. A lot of people don't know that maternal suicide happens in the postpartum period. The majority of these deaths are happening in the postpartum period. A big problem with postpartum everything in America is that we think it's a 6-week period, and it's not. Now advocates and feminists start saying postpartum is forever. It's forever. And I think we're finally having a really frank discussion about not only mental health, but about women's mental health, and especially in the postpartum period. It is statistically worse for people of color and women of color, especially working people of color. There's a lot going on now about Medicaid extension, so I think that will help a lot because a lot more women of color are obviously are reliant on Medicaid. So I think that would be a really good. I'm very hopeful about the new pill that we have and the legislation that we have on Capitol Hill, it's not moving. But to extend Medicaid would be a huge help. But yeah, it is an issue, and I think that finally people are starting to take women seriously when they tell their doctor something's wrong or they don't feel good, and it's not just the baby blues. The issue of postpartum in America is also really interesting because a whole bunch of different issues are coming and making this one issue really bad, which is America's C-section rates have jumped 500% in the last generation, okay? We don't have paid family leave. We're the only industrialized nation that doesn't give women paid maternity leave, okay? Most women get back to work, 2 weeks later, we approach C-sections as, oh, you're in and out, go home, and it's a major surgery, and we're sending women home, with their babies and with their stomachs, I mean, I had 2 C-sections, and my doctor never told me what a big surgery it was. And now people are like, oh, now OBGYNs are talking about how when you do a scheduled C-section, you have to go through all the layers. But when it's an emergency C-section, they cut you open so fast, they have to, sew you right back up, and then you're really on your own. You're really on your own. Affordable child care, no paid leave, rising C-section rates, and these are all coming together, and we're seeing it in America's maternal health.
Awesome. We see that this racism permeates various aspects of society, not just healthcare, economics, insurance, like Alicia was saying, and it shows in the disproportionality. So the rate of women of color who are receiving Medicaid is disproportionately high to those of other groups. Please talk about women's role in being complicit in other women's treatment.
Yes. Yes, that is a really good question. So I talk a lot about believing women, but often women don't believe each other. So it's a double-edged sword, okay? I think it's like that in anything, in healthcare, in business. women need to be on each other's side. I think that we have been told for so long not to.
Clap, you can clap.
Yeah.
Don't leave your sister hanging out for
I understand why the patriarchy and the system has always wanted to keep us apart. Women are so powerful. We are so powerful. We can network and connect and organize better than anyone. And I feel like it's a big conspiracy to keep women divided because it makes us weaker. So next time you see somebody else, like the importance of, this is where I love to talk about the importance of mentors and mentorship. Take people under your wing, keep learning, but also when I see young women now, like I feel like, I don't know if this generation, what is it? The X generation or the millennials or the Gen Z, like I can't keep up. I think I'm a boomer compared to them. Just kidding. But I feel like in so many ways, like they give me so much hope. I see them and I'm like, yeah, that is how you do it. Don't start bickering within each other. Like try to fix the system, change the system. Who is the, what are the signals you're getting from leadership? Why are we fighting over scraps? So I feel like women have been pitted against each other for way too long, but I also feel like that tide is turning. It's a new generation of women.
There is some hope.
There is
hope that you're hope.
I always wonder, I was so polite to that doctor. That doctor who delivered me, who I had never seen before, they also don't tell you that it's probably not going to be your doctor who will be delivering you. And by the time I got to the OR, I had been in labor for 33 hours, I had pushed for 3, I had 104 fever, my epidural, which they told me I was over the legal limit, was apparently had slipped off, so I was never hooked up to any pain medication. And when they finally decided to do that emergency C-section, and they throw me in the stretcher in the operating theater, the doctor didn't believe me. He didn't want the nurses to help me get off the stretcher. He wanted me to walk to the operating table. He was like, it can't be that bad. And at this point, can you imagine? I have a baby stuck between my legs. Sorry for the TMI, but it's TMI when it's about women's health. I'm shaking. I have a fever, and this man still didn't believe me. We want to talk about dignity, and I think about him, and I'm like, was that man racist? Was he sexist? Was he both? And then I think about my kids, and I'm like, my youngest daughter would have punched him in the face. She would have told him, like, what the heck, So sometimes when I get really depressed or just down about stuff, I'm like, it's not worth anything. I'm like, it really is. Because the next generation of women are really badass. I know I'm biased saying that about my own girls, but I look at them and I'm like, they would never put up with that,
Interacting with communities across the U.S. and the world, where have you found or research shows that there are more male allies?
Ooh, that's really interesting. I don't have any data on that, but I do know that I would like to say off the top of my head that I think it would most likely be Iceland. Because did you guys hear about the time when women were like upset about equal pay in Iceland and they stopped sleeping with their husbands? And I think they got like equal pay within like a month. So I think that
Are you aware of any cities or states that have successfully, I can't read that, but successfully implemented changes?
Yes, New York is doing a good job. Black women in New York are like 9 times more likely to die. It's really bad in New York. California is doing some good work. I feel like, without getting into a lot of politics of what's going on with women's health, I am hopeful that there's going to be some, I have hopeful change on the horizon.
Amazing change is coming. Hold on. Those are the lyrics of the song. But
hold on,
change is coming. And thank you, Anusha Hussain. She's going to be here for a few minutes before I have to whisk her off to the airport. So thank you. Can we give her a round of applause? It's so good when we can have laughter even about this, knowing that there is hope, that we can make a change if we begin to work together. we can do this. So I'd like the singers to come up for our song of unity and giving. They're taking their time. They're just, oh, we're all gonna sit on the stage. Come on. And we're gonna entreat you all to join us at some point. Oh yeah, there's 3. Okay. All right. So.
Just check the mics for a second. Sharon, if I could have just a moment.
Okay.
Folks, we've locked the doors, so you have to say it. My name is Maestro Lover Nance, and it's my pleasure to support Sharon. I could not say no to her. I don't think you can either. But I did want to say, after Anushe's wonderful presentation, I want to say, speaking for the guys, my mom was a woman. Hello. And she would be ashamed of me if I didn't support women's issues in this. And I think all the guys in this room certainly are on that same page. So we're going to do this wonderful song with wonderful volunteers from Health Visions who have volunteered to lift their voice. And we're going to do the refrain to We Are the World several times. And when it's in English, you're invited to join in, and then Lupita. And when we're going to do it in 2 different languages, and we're going to let them do it, enjoy the sound of another culture. And then we're going to come back to the song and sing it one more time. So when we have an amen, we're going to sing.
Amen. Amen.
Right, thank you.
There comes a time when we hear a certain call, when the world must come together as one. There are people dying. Oh, it's time to lend a hand to life, the greatest love of all. I gotta say that again. Just listen to the words. They mean so much. There comes a time when we heed a certain call, when the world must come together as one. There are people dying. Oh, it's time to lend a hand to love, the greatest love of all. We must go on, pretending day by day. We just can't do that. Sometimes, somewhere soon, we'll make a change. We are all a part of God's great big family. And the truth, you know, love is all we need.
Go everyone.
We are the world. We are the children. We are the ones who make the greater day. So let's start giving. There are choices we're making, and we're saving our own lives.
chip that ball, don't chip that lady. Don't let it break, that y'all make, not a million. Oh, no, come with it, why you let it play? That dog, young, not your man.
Children. Thank you so much for joining us today.